Hello beautiful people, welcome back to Rebuilding Hope, the art and science of breast reconstruction with me, Dr. Chia Hui Ling. Today, I'm thrilled to have a special guest, Dr. Chia Hui Ling, a distinguished plastic surgeon and co-founder of Breast Reconstruction Awareness in Singapore. Dr. Chia has dedicated her career to supporting breast cancer survivors through their reconstructive journey and raising public awareness about the importance of breast reconstruction. Join us as we dive into the world of breast reconstruction and the incredible impact of her work. I had a friend that had breast cancer, and she told me that after she had the breast cancer removed, she actually had augmentation. So can you tell me, how popular is this kind of procedure nowadays to have augmentation after breast cancer surgery?
Actually, now it's very common to have reconstruction after breast cancer surgery, and of course implants and augmentation is one of them. And the other options are to use your own body's tissue, or actually there's another method where if part of the breast is removed, you can actually do what we call oncoplastic procedure to rearrange the breast tissue to make it into a breast shape again.
Wow.
Yeah.
Okay.
So those are the common methods. Quite common nowadays because we know the benefits of immediate breast reconstruction as opposed to delayed breast reconstruction. Because when the patient wakes up from the surgery, they don't actually have the feeling that they lost the breast.
I see. I mean, a few questions come to mind. The first is, once they've removed the entire breast, like a total mistake, can it be reconstructed or only if you remove part of the tissue?
Okay, so strictly speaking, for medical terms, reconstruction is only when you rebuild the entire breast. So as part of mastectomy, the entire breast is removed and then it is replaced by tissues or synthetic materials like implants.
I see.
If it is partly removed, then the term to describe the form of reconstruction is oncoplastic surgery.
I see. Then you don't actually even need an implant. You can just rearrange the tissues like you say.
Yes, rearrange the tissue, or we move tissues from close by, like from the chest area to
that's
or
very
the
clever.
tummy area, and shift it into that defect where the tumor is taken.
And when you say tissues, you're talking about fat, right? So the lady must have some amount of fat.
Yes, correct.
So somebody like you will have no chance because you're so skinny.
Yes, yeah. So first you must have the resources,
right?
Resource to donate tissue to the breast. So if there's not enough, then either we can actually stack even the tissues.
Interesting.
Or we use an implant. Or combination.
But out of these three methods, which is the most popular?
I would say at the moment it's about 50-50 implant and own body's tissues, which we call autologous.
So for this kind of procedure, is this all done in one setting, or do people stage it, remove the tumor first and then reconstruct?
So usually removal and the first step of the reconstruction can be done at the same time. Most people only need a single step of just a single reconstruction, but there are some reconstruction that need to be staged. So for example, if we don't have enough skin and we need to recruit more skin, we actually put an expander in, like a balloon, which is expanded over time. Then the body essentially grow new skin, and then the final reconstruction is done at the second stage.
I see.
But I would tell most of my patients that after your reconstruction, even if it's one stage, there may be follow-up procedures. For example, nipple reconstruction. So for those that have lost their nipple, can have nipple reconstruction. And also touch-up procedures. For example, if they lose weight during chemotherapy or have some tissue loss during radiotherapy, fat grafting or some scar revision can be done to enhance the overall result.
So you're saying that some people will have this reconstruction and then they have radiotherapy after that, which then may affect it, and then you can always do some touch-up. One thing that's very interesting is, a lot of people worry about breast cancer due to implants. So does this stop women who are having reconstruction from choosing this option?
So this is a common misconception that implant causes breast cancer. So actually, conversely, implants are used to reconstruct after someone have lost their breast to breast cancer. There is no evidence to show that implant causes cancer, breast cancer. Sometimes it may be confused with another condition, which is called ALCL, anaplastic large cell lymphoma. And this is not cancer, it's a form of lymphoma. And this is only not caused but related to breast implants that are macro textured. But that has been already taken off the market in Singapore at least.
So we no longer use macro textured implants.
Correct.
So what kind of implants do we use now?
So usually we use the smooth surface and silk surface implants.
Oh, I see. And then of course another question most ladies will ask is, are these going to last me forever, or do I have to change it like I change the car engine oil?
So it is a medical device after all, so you would need to change them. Probably the lifespan will be about 15 years or so. However, with the newer generation of implants, they actually they are more durable. And sometimes if you reach 15 years and the implant during your screening is not giving any issues, you may delay it.
You can still choose to keep it, but you may,
But I will tell patients, when you reach a certain time, you may want to change to a new set of implants, and you may have then receive implants that are of a newer technology.
I see.
And the second surgery is usually easier than the first surgery. Because the difficult part, the painful part, has already been done in the first step in most of the cases.
Which is creating the space for the implant to go in. So once you have a space, it's a bit like changing.
Yes, correct.
So the space there, just changing the implant.
The surgery is shorter and less invasive.
So, how long does this surgery take? Just the reconstruction, putting the implant in, is it very long?
Usually implant reconstruction doesn't take very long, about 1.5 to 2 hours, just like breast augmentation.
Just like breast augmentation. And how about the scar? Or does a breast cancer patient don't usually worry about the scarring so much?
So for breast, we will follow the scars that was done for the mastectomy.
I see.
So even with between breast surgeons, they have different types of mastectomy scars. It may be across the nipple, or it may be below the breast fold, or even laterally at the side. So we will follow the incision where the surgery is done from, so that we don't create new scars.
So you're not actually adding to the scars. So what you're telling me is that I could possibly, if I was a breast cancer patient, I could possibly go in to get my tumor removed, and then when I wake up, I still have a breast. That means having both done in the same procedure. So that must really help me mentally, right? Psychologically. So I always tell my patients that breast reconstruction, it helps with the rehabilitation, their psychosocial well-being, because the breast on its own does not really have a very vital function. Compared to liver or the heart, when you do an organ kind of transplant, right? So, but it does help women to go back to their usual lifestyle, to retain their quality of life. Because with a very extensive screening program these days, tumors are picked up very early. And cure rates are very, very high. So I tell my patients that if you do a mammogram, it will pick up a tumor, maybe even 2 years before you can feel it. Oh my gosh.
So it is definitely worthwhile, and I encourage all women to do breast screening when they reach the age of 40.
Does it mean you're seeing younger and younger patients, right? Because of the better screening nowadays?
Yes, that's right. That's right.
Because recently I had a patient, and she's not young. I think it's in her 60s, and she had a mastectomy. But I think she feels very resistant to a breast reconstruction because she thinks of it as very frivolous, and what will her friends think? What would you say to somebody like her?
I would say that if you are of good health, and as you know nowadays, many 60 is the new 50, right? So if you're healthy enough to undergo reconstruction, then I would encourage you, especially if you lead an active lifestyle. If you go swimming, you go out with your friends a lot, you want to feel confident in your swimwear, you want to do your exercise comfortably, then reconstruction would definitely be recommended for patients like this. I have patients that are in their 60s who have undergone reconstruction. But of course, as we grow older, we may have more what we call comorbidities like heart problems or lung diseases. And if patients have comorbidities, then I would not perform a more invasive surgery for them.
Okay. So what kind of complications should we look out for if we undergo augmentation after breast cancer surgery?
So for implant reconstruction, I usually tell patients that it can be the implant related or the surgery related.
Okay.
So implant, again, the device, it can rupture. Or you can develop what we call a capsular contracture to it. That means the implant don't feel soft and natural anymore. It feels a bit firm due to the capsule tightening around the implant. So these actually...
And you can actually feel it. I mean, the woman can actually feel it, or you need a doctor
you can feel it, but with the new implants these days, the rates of rupture and capsular contractures are very low. And the implant company actually gives a warranty against it.
Okay.
So these complications are less common nowadays. Then of course with the surgery there are risks of infection, bleeding. Thankfully these are pretty low.
But can be managed.
Can be managed.
Okay.
Yes.
And you know this capsular contraction, how long after the surgery should we look out for? I mean, a month, a year?
It can start from as early as a year to more than 10 years after the implant has been placed.
And nobody knows why it happens. And is there anything to do to prevent this?
So if you compare reconstruction with augmentation for cosmetic reasons, the reconstruction will have slightly higher rate of capsular contracture because of the extensiveness of the surgery that was done prior to putting the implant in, which is the mastectomy. And also there are less healthy tissue surrounding the implant. So when you do an augmentation, you have your breast still around the implant, so that kind of shield the effect of the problem.
Coming to augmentation, which I'm sure everybody here is very interested about. I guess when you do augmentation, your patient subset is usually younger, right?
That's right, that's right.
Yeah. And I think one of the myths we used to hear is that, silicone will leak. Does that still happen with the new implants?
So for silicone implants nowadays, we call them form stable or gel-like or monoblock, which means that they do not sort of flow out like lava when there is a rupture or a puncture. So generally that doesn't happen. So you don't get silicone like migrating into the body. It tends to stay as it is. And our body has a very smart mechanism. So what it does, it forms a capsule around the breast implant. So actually around any implant, so even if you have plates and screws from a fracture, your body will form a capsule around these implants. And that can wall off even if you have a gel leak or silicone leak. So actually, I have managed a few rupture cases from older implants. And actually, I have not seen one. It does happen, but it's not common. I have not seen one where it sort of leaked outside the capsule. So that's how effective.
So it's actually not very common, not like what they say. So the latest implants, a bit like our gummy bear, where you bite into it.
Yeah, like agar-agar. I tell my patients it's
it
like
doesn't
agar-agar.
actually leak. So what is your youngest patient to do breast implants? Would you turn a patient away if she comes at 18 years old and say?
Usually I would tell patients that wait until your breasts have fully developed. But there is no golden age, so everybody develops differently. I would tell them, when you feel like your breasts have not grown for the last 2 years or so.
Then I think it hasn't grown for me for the last 2 years.
So usually around the early 20s.
Early 20s.
And of course, if the patient comes in at 19 or 20, they're mature enough to understand the procedure, the risks, and their parents agree, and the parents come and sign the consent form, then I would do. But in general, I do not do anyone younger than 19 years of age.
I understand, And then how about breastfeeding? If you're doing somebody in the 20s, presumably they haven't started a family.
Correct. So I will tell the patient that I have patients that have breastfed and then done implants and then breastfed again.
Oh my
so
gosh.
which means it doesn't block the function of breastfeeding.
Yes.
I will tell them that when you have implants and you breastfeed, you feel more engorgement.
Okay.
So that's the main difference that patients that have done breastfeeding before say about what it feels like, what feels different after the implants, because they feel more engorged than before the surgery.
I see.
And I also tell these younger ladies that, you see in social media, there are a lot of women that promotes that they have so much breast milk, right? And they are like have deep freezers of breast milk storage.
Yeah.
But actually, a lot of women also do not have enough breast milk with their busy lifestyles. And so your ability to breastfeed, whether it's low or high, has not been determined yet.
I
so
see.
it's not to blame yourself that you have done implants and that's why you can't breastfeed, because it just could be
just genetic. Maybe you just don't have very much milk.
Correct.
I see.
Right.
So what are the most common reasons women come to you for breast augmentation? Is it just to increase the breast size? Or?
I would say that the women that comes have two main age groups.
Okay.
One is in their early 20s, where they find that after their breast growth has completed, it is still quite small in volume.
Okay.
And the other group will be women that have completed their family after breastfeeding and undergone like deflation or what we call atrophy of the breast.
Okay.
And it can be quite shocking to a lot of women. They come in and say, after I stopped breastfeeding, it completely disappeared, their breast. And so these women are actually form the biggest group in my
the second group. So it's true, after breastfeeding, your breast can deflate a bit.
Correct.
Because you hear about all these celebrities that says, well, after breastfeeding, my breast went up 3 times and I lost all this weight.
So
that's not the norm.
That's not the norm. So I do see a few patients that the breasts increase in size after pregnancy and with age. And these patients often come for reduction because they will say something like, well, no matter whatever I eat, it just goes to my breast.
Oh my gosh.
I know, right?
I want to know what they are doing that I'm not doing. I want that problem.
And all my nurses will be like, wow, so envious.
Has it something to do with the weight? I mean, are they
I think it's
bigger?
It's genetic,
It's genetic?
hormonal.
Oh my gosh.
And it is
so lucky.
But uncommon.
Uncommon.
Breast reduction surgeries are much lesser
than the augmentation, right? Okay.
But satisfaction, very high for patients that have done
because I'm
breast
sure it
reduction.
must be quite, well, I can't speak from experience, but I think it must be terrible to live with such huge breasts, you know?
It's disabling for them.
Right,
So
it's exercise,
they cannot find clothes, they
running.
cannot exercise, they have back pain, neck aches, shoulder aches.
Okay, so it's really a problem,
And
But coming back to that topic, how about asymmetries? I think I have patients actually asking me and actually showing me their breasts that it's not very big, it's not very small, but there is significant asymmetry.
Correct. So I see women's chests a few times every day, and I would say that everyone I see will have a little bit of asymmetry, but significant asymmetry, I would say that maybe in all my augmentation patients, about maybe 10 to 20%, I would use different size implants.
So actually the aim of augmentation isn't just to make it bigger, it's also to make it more beautiful, right? More symmetrical.
More symmetrical, a better shape. So there are women that come to me that they just want the breast to look more of a normal shape.
Right.
They don't actually want a full enhancement or augmentation.
Okay.
For example, women with tuberous breasts, where their breasts have a shape that is more pointy, more narrow.
Right.
That just doesn't sit right on their body, and they can be very self-conscious, especially young ladies.
Yes.
And they may feel so self-conscious that they don't want to meet men because of that.
I see.
And so I think these women will benefit a lot by just changing the shape of their breast, so they feel that they appear more normal.
Yeah. Do your patients tell you that they actually get better confidence after doing this procedure?
They say, and they look like they have more confidence after they come back from
so
surgery.
it really does, it's not just physical, it's also a bit mental, isn't it?
Correct.
How about sagging? Because you mentioned that after breastfeeding there's a lot of deflation. So I presume it's also a bit of sagging, it's not just the volume, right?
In mild cases of sagging, the medical term we use is ptosis.
Yes.
For breast ptosis, if it is mild, you can use implants to actually lift it.
Okay.
So I tell patients that it is like a deflated balloon.
Okay.
Right, which is has a sagging shape.
Yeah.
So if you increase, put volume into it, it will lift the sagginess.
I see.
However, if the sagginess is very advanced, then theoretically, if you put in a big, huge implant, like a 1,000 cc implant, it will also lift it, but it doesn't make sense.
Doesn't make sense.
So these patients, then I will do a breast lift surgery. Where I remove some skin from the overhang, the sagginess, and also rearrange the breast tissue so that with sagginess, most of the breast tissue is below. And then rearrange it more to the upper half of the breast.
So on top of the implant, you can actually do a lift that will also lift up the skin per se.
And you can do a lift without implant. Because actually, women with saggy breasts, a lot of them have enough breast volume. But it's just that it's more inferior, lower down. So it is about rearranging it to the top.
So I presume if you do a reduction, you need to do a lift as well, right? Because you are reducing the volume. So
the lift is part of it.
I see. But how common is the reduction in Singapore? I can't imagine anyone in Singapore complaining of.
I think being a female plastic surgeon, I would say I see relatively more breast reductions. I would say that quite a few times every month. So it's quite common actually.
And these are Chinese women or Caucasian?
Or mixed, or ethnicity. Of course, it is more common in women of Indian origin and Caucasian origin in Singapore.
So I'm going to ask the questions that all the girls behind the camera are waiting for me to ask, which is, for implants, is there a scar, and will their boyfriend find out if they don't want to tell their other half?
Yeah, there will be a scar, just because we need to place the implant.
So must date somebody with very poor eyesight.
But the scars usually nestle quite well in the underboob crease. So I would say it takes about around a year or so, and the scar will look more skin colored and more like a crease. Right. So with Asian women, I would frankly tell them your scar will look dark in the first few months. That's how we scar, right? We scar very brown to start with. We can start lasers to help lighten the color. We can use fractionated laser to improve the texture. And with the new implant nowadays, like Motiva implants, because of the fluidity of the implant, it can be pushed through a funnel. So it can.
So you don't really need a big scar.
Some 2.5, some of my patients less than 2.5. I can put a small
implants are great, you know. And I actually remember also seeing some of your patients. The scars are really small, and after the lasers, you're right. I mean, for us Asian patients, even a mosquito bite also has scars, right?
Scars.
But I must say that after doing the lasers a few times, they do lighten up. So it's not the be all and all. It's just whether the patients wanted to pay a bit extra for some lightening creams or lasers or not at all. The second thing is, if they do go out with a guy with very bad eyesight and haven't seen the scars, can their boyfriend feel and know that they've had implants?
With Motiva implants, which is the implants that I use more commonly, the feel and the movement of the implant is more fluid, and it moves with the body more. So it feels more
not stiff, right?
Feels more natural. If I have a patient that is very, very thin, like BMI like 16 or 17, very, very thin patients, then I will tell them that you may be able to feel the implant if you are very, very slim.
I see.
And the way to overcome this is to add a bit of fat injection.
So lay it on top of
like
the
a cushion.
implant.
So the more breast tissue you have, the more fat tissue or breast tissue you have in front of the implant, the softer your implant will feel. So it's dependent on the patient's pre-existing habitus as well. But with very slim women, I'll tell them that I may have difficulty finding some fat in the body for fat grafting. But usually for women, we are quite good at hiding fat. We usually have some in the inner thigh or the banana roll, the roll below the buttocks. Those are quite good areas.
And people cannot donate fat for your breast, right? You have to find your own fat.
I would like to open a fat bank. It would be very popular, but
I will
it's
donate.
not possible.
So another question is, if their boyfriends grab their breasts, how hard can they grab before they rupture the implants?
Actually, it's quite difficult to rupture.
Even in the heat of passion?
Yeah, I mean, I have not had patients who come to me with rupture implants after manhandling. After
very strong manhandling.
Yeah.
Okay.
And if you see some implant videos, you can see how the implants are pulled to like 5 times its length.
Wow.
And 5 times its area, and it still maintains the integrity of the implant. And that's the same reason why I can push it through a narrow funnel, because your implant needs to be fluid yet strong in order to be able to push through the funnel.
So in the cases of rupture, how did they rupture the implants? I thought it was from people grabbing it or something.
In the past, the implant wall, when it is a textured implant, sometimes they fold at an angle in the body. And when it is folded, it creates this like a little sharp angle that I think when it abrades over time, it wears down. And again, it's just a synthetic material. Just like a plastic chair can also break down.
More wear and tear over time rather than a daily handling issue.
Correct,
So I do Brazilian Jiu-Jitsu, and I'm very sure a lot of my friends in Brazilian Jiu-Jitsu wants to have bigger breasts. But the question is, can they still do Brazilian Jiu-Jitsu where they are like, slamming their chests on the floor?
I tell patients that they can do any exercises after the breast augmentation, but after a certain period of time.
So immediately after, no.
So no exercise, of course, you just recover from surgery in the first week, no exercise. And then 1 month later, you can do shoulder and jumping exercise, only 1 month after.
Right.
Yeah, correct.
Then how long before I can go back to full exercise?
After
a month.
A month onwards.
So within that month, you can do shoulder.
After a week, you can do most light impact exercises, but no moving of the shoulders. And no jumping up and down like burpees or jogging. And then after a month, you can do all that, but start slow.
Very nice. So how long is this surgery? Is it a very big surgery? People going to stay overnight?
Breast augmentation usually for straightforward cases can be done within an hour. I would tell most patients,
that's
usually within 2 hours.
The time taken for eyelash extension, an hour.
That's right.
Right.
Yeah.
And then they can go home?
They can go home after recovering for about 1 to 2 hours.
How about flying? I hear a lot about the breast implants are going to kind of explode, right? Mid-air.
So I have patients who, fly in from other countries for breast augmentation. And I tell them, at least stay a few days for me to make sure that everything is stable. But I will tell them after 5 days, they can fly. Before 5 days, not because it will explode. It's just that I want them to be comfortable, and I want to make sure that they are well before they go.
I see. So most likely it's a day procedure where they come in, go back, and then they can go back to their home country like 5 days later. With the exploding implants, likely is because they are, the saline type implants or implants where it is injected, the saline is injected in. So there can be air bubbles within it. And then when ladies fly, it expands. So for the gel implants, it doesn't have any air bubbles within it. So it's not an issue. And we don't use the saline implants anymore, do we?
No, I don't. I don't use the saline implants. When I do expanders for reconstruction, where I put in the expander, then I inject saline into them.
I see.
Which is a temporary
But that's just
device.
to expand the tissue, and then ultimately you're going to put a proper implant in
correct,
at the end.
correct.
Then any special aftercare for post implants? Like, do they have to wear a special bra, massage their breasts every night?
No massage.
No massage.
So for at least for my approach, I do not. I ask patients not to massage the breast. Especially if I use Motiva implants. It does not form a firm capsule. So I tell patients not to massage their breast. They can go for body massage, usually after a few weeks after surgery, but they should not massage their own breast, because it will remain soft. You don't need to massage it.
So the partner shouldn't touch the breast till it's
I would
settled.
say usually, if patient asks me, I say maybe after a month, it's gently, it's okay.
So can view for the first month, but like a museum piece, it shouldn't be touched till after. Yeah. Then how about the bra? Can they wear normal bras or do they need to wear a sports
I
bra?
provide a bra for them.
You provide
for all
a bra,
my patients,
okay.
whether it's reconstruction, implant, reduction. I will provide the initial surgical bra, which
Okay.
is more for compression reason to limit movement, limit bleeding, and then after that, I will switch them back to their usual bras. Yeah.
And should they be wearing this bra the whole day, including sleeping?
For the initial week,
Yeah.
the surgical bra, yes.
Ah, okay.
But after that, at night, usually I tell them to wear at least like a snug t-shirt.
Okay.
You don't really have to wear a bra to,
Yeah.
support it from gravity.
Right. I mean, as an expert on breasts, I thought I'll get your opinion. What do you think of wearing bras to sleep, even if you haven't had breast augmentation surgery? Does it keep our breasts perky?
So for patients with fairly full breasts, or if they have implants where there are more weight on the chest, I will tell them to wear something like a snug t-shirt.
A snug t-shirt
Yeah.
is enough, just to have some
To
lift.
hold mainly the sides.
Why the sides?
Because when I tell them in the daytime you wear a bra, that gives a lift up and in.
Oh,
Basically, it gives you will be able to see a bit of cleavage.
Is it because the implants move apart?
Implants, breast implants, they have a tendency to move down and out. That's the direction of breast aging.
I see.
Right? So,
okay.
So you need a bra to counteract these forces, right? But when you sleep at night, it's only a lateral
So
force.
that it could move out.
Or out. It will not move south.
Yes.
So a snug t-shirt that has a good coverage of the sides is good enough for nighttime.
How about people who have not had breast implants? That's still a good practice.
Yeah, if
so
you
that
have-
when they sleep, the breasts don't.
Correct. It's like I tell patients that it's a good habit, whether it's breast that had not had surgery or reduction. It's just a good habit to
So wearing a
maintain.
bra is a good habit rather than not wearing a bra and doing any sort of exercise, right?
I'll tell patients that you don't really need under wire. Doesn't mean it has to be under wire if you have fuller breasts. Just something that you will comply with. Because if your bra is uncomfortable and you may not want to wear
may not
one.
want
So
to.
something that is comfortable and give the breast an up and in lift.
Okay, that is actually very useful. So tell me, what happens if I want my breast to be bigger, but I don't have the guts to go for breast implants? Do I still have options?
Fat grafting is the other
grafting.
option. So fat grafting is using your own fat to augment the breast.
Okay.
And usually it's a very popular surgery as you can have the good side effect of losing fat from
Kills two birds with one stone, right?
Correct. You can recycle. My patients say I want to recycle my fat into my breast. So
Which areas can we take it from?
I usually ask the patient, so where is your area of priority?
Wow, a lot. Okay, so they will take
I'll take from there and
stomach, inner thighs, outer thighs, no problem.
yeah. I prefer to take from the thighs because a lot of the ladies, they may look like they say they have a very big tummy.
Yeah.
And often after pregnancy, they will say that they have a big tummy and they want to remove the fat. But actually the fat compared to the thigh is much lesser.
Oh, okay.
A lot of the fullness of the tummy after pregnancy is weakness of the muscle, or what we call diastasis recti, where the six-pack muscle is a bit separated and lax.
Yeah.
So actually the tummy has less fat storage compared to the thighs for most women.
Yes.
Women, yeah.
So if a 50-year-old lady goes for this procedure compared to a 30-year-old lady, does it mean the fat of a 30-year-old lady would be more viable, so her results would be better because it's younger?
Yeah. So if you are younger, your fat retention
stem
rate
cells.
is higher. In general, I say it is around 70% retention, which means I put in 100%, probably 70% of the fat will survive.
That's not bad. Is it permanent or does it go down after a few years?
It is permanent, where it will behave like where I took the fat from. Right, so of course, as we age, our body shape change. So we may lose some fat from our our butt area.
Yeah.
So it will just follow the natural course of the fat from that area. And I tell patients, if you have where is your stubborn area? Where is the area where when you exercise, it doesn't go away. And when you eat, it's the first place to expand.
So that is the area you want to take it from.
Yes, that's the best
So you
area
want stubborn
to,
fat. Okay.
I show patients the pictures of some of the before and after so that they can understand and to manage their expectations. So I show them the patients that of different ages.
Yeah.
And you can see that the retention of patients that are older, they have less retention.
Okay.
Yeah.
But I presume this procedure is not surgical, right? Or is it still surgical?
It's surgical,
You
yeah.
still have to be sedated.
Yes, correct.
Okay, because of the extraction of the fat.
Yes, because it's liposuction.
I see. And then the fat is then injected in, so there's no scar, so that's the good thing.
Yeah.
Okay. But then it sounds like it can be repeated, even if it is not retained, you can find new fat and then inject again, right?
Yeah, if you like the effect and you have enough fat, then you can repeat the procedure.
Okay.
I tell most patients you have to.
But it behaves like fat, right? Which means that if you gain weight, all the fat cells in your body presumably is going to expand.
Yes,
so then your breast will...
Yeah, it will expand.
Wow, okay.
But if you lose weight, it will also decrease. Yes.
Okay, so is there like a age limit where you don't think that our fat is viable? Like, beyond a certain age, no point doing this?
My oldest patient that have come to me for breast fat grafting is around 50 odd years old.
Right.
Yeah.
Okay.
So I haven't encountered anyone older, but again, it depends on their health.
Yes.
Whether they want to risk if in the 60s again, they may have other comorbidities.
I mean, the other question is how much bigger can we go with just fat, and how much bigger can we go with implants?
Generally, it is around half a cup.
That's
the most modest.
Most modest.
To maybe 1 to 1.5 cup size increase. There are a lot of factors surrounding this. So first, how much tissue do you have on your chest? If your breast tissues are very, very thin, then there's not much space to put the fat in. We can't put fat in like it's an implant, like a blob.
Because the fat will be compressed, whereas the implant has more of a structure.
Yeah. So the fat needs to be bathed in healthy tissue to survive.
Okay.
Because when we remove it from the body, it's not alive. It's theoretically dead.
Yes.
And then you put it back into the body need to make it alive again. So it needs to be, every cell needs to be surrounded by healthy tissue in order to survive. So it's like spreading sand, you need to spread it out a lot.
Yeah.
So if you have very thin tissue, like a thin sponge can only absorb a little bit of water.
Not much, Right?
So if you have if you have thicker breast tissue and more fat, then you can go up to 1 cup, 1.5 cup size increase.
Okay.
So it depends on the body frame.
Okay. How about then implants? Can you go up a lot more?
Implant, yes, you can go up a lot more because, like I say, you put in like a block, right? So for every volume, it will look more because it is all concentrated as one blob. As opposed to spreading it out everywhere.
So it's just a matter of whether you have enough fat coverage to make it look natural.
Natural, yes.
Because you see in those celebrity magazines where they are wearing the bikinis and you can clearly almost see the outline of the implant.
So that can be due to 2 reasons. One is, they are too thin. Like I tell you, patients that are like BMI 16, 17, you can see their ribs very clearly. So if you put an implant in,
I haven't seen my ribs for like 30 years already.
So these patients, I will offer them fat grafting. But another reason why the borders of the implant can be very obvious is because of capsular contracture, which is, like I told you, one of the complications that's rather common in older implants, where you can actually see the borders of that contraction.
So nothing you can do once you get capsular contracture, but to remove the implant and change a new one.
And do a capsulotomy, and then change to the newer generation implant with lower rates of capsular contracture. And then if you already have capsular contracture before, you're at the risk of that, I will start patients on some medication to hopefully prevent that occurrence.
Moving to the problem which I don't have, which is big breasts. I'm very interested about breast reduction. What kind of women actually undergo it? You mentioned just now it was mainly like people with some back issues, neck issues.
So women with overly large breasts can have problems of from weight, shoulder ache, neck ache, back ache. So I actually have referrals from orthopedic surgeons before because they are young ladies with advanced wear and tear, found in the spine area from the MRI due to the heaviness of the breast. And they will have other issues like difficulty exercising, so they put on weight. They also have problems finding clothes, and some even have rashes or fungal infection from the breast fold under the breast. So it is actually a very medical condition. So just like breast reconstruction and breast reduction, one misconception that I would like to address is that it is actually considered medical surgery. So women, when they come in, they say, "Oh, is this how much is this going to cost? Is it cosmetic? And I have to pay myself." And usually these are a medical surgery if they fulfill certain criteria. So of course, reconstruction, it has to be secondary to cancer surgery. And for breast reduction, when there is a significant amount of breast that is removed. And this can vary from country to country and sometimes even vary between different insurances.
So actually the insurance may even cover this if it's actually related to a health condition.
Correct. So,
that's so interesting.
For example, if half a kilo, which is 500 grams of breast, is removed.
Oh my God.
It is
I think I don't even have 500.
And some countries, like in the UK where I work, your BMI needs to be within a certain range as well. At that time, it was below 27.
So that is really a huge breast and not because you're obese, right?
Yes.
Then it is a medical
in relation
condition.
to your body frame.
I understand.
And these patients have very high satisfaction after the surgery. So it's really changed their lives.
What do they tell you after the surgery?
They are lighter. I have patients 2 weeks after surgery, they say my neck ache and my back ache is gone.
That's crazy, right?
And I have a patient, she had a fairly large reduction and she came back to clinic in a crop top. I'm like, wow, you're wearing a crop top, and she's so confident, and she's exercising, she's lost weight. And so it is really a very important surgery, I would say, that is often not spoken about.
That's really eye-opening. We always think of women's breasts as, really cosmetic, but actually it can also cause a real health issues, and not bigger is better,
So it's likewise in reconstruction when a woman has breast cancer on one side and the other breast is very, very large. I reduce the other side and then make a smaller reconstruction. Because firstly, it doesn't make sense to give her back a large breast that is giving her
actually
problems.
Improve both breasts to an optimal size rather than base it on the other breast.
Correct.
And just now you mentioned nipple surgery, which I haven't touched on. How does that work to create a new nipple?
The nipple can be created in a few ways. So one way is to use whatever skin and tissue you have on the breast and then fashion it into a nipple shape.
Wow, does it look real?
It looks pretty real. So most patients are quite impressed by how it actually looks like a real nipple. Another way is what we call nipple sharing, where the nipple is, if you have a larger nipple on the other side that has enough volume to share, then I will take half of the nipple on the other side and graft it onto the...
Nowadays you can do anything. That's really incredible.
You can also graft it from skin and tissue from the genitalia.
Because the colour is darker.
Because some patients, we can take it from where the labia is, where it is, there's some extra tissue there, and it's darker. It actually matches the darker nipple colour as well. And of course, the more straightforward way is some patients do a 3D tattoo. So actually, it is not a 3D shape, but it is tattooed.
So basically, you can work with these tattoo artists to really create something that is quite realistic looking. So I mean, women really have a lot of options nowadays. They don't actually have to live with any form of disfigurement, not like in the past where I have very old aunties with mastectomy and they literally lived with not having a breast for years.
And also I feel that our techniques, the implants has really improved. I was at a breast talk by Breast Cancer Foundation a couple of years back, and somebody actually said that, oh, my mother's reconstruction is so bad that I so don't do. Right? And so I had to sort of clarify that actually, with good planning and better techniques these days and better implants, you can get a breast that is very similar to the other breast. However, of course, it's not perfect, right? The feel and the consistency may be different. You still have scars. And one thing is sensation. So when you have a mastectomy, the sensation of the central part of the breast is usually numb. Periphery, you can get some sensation, but centrally, usually numb, because mastectomy removes the nerves and the breast. And actually, we have new techniques now where we actually do microsurgical anastomosis of nerves. From the chest, nerves on the chest wall to the flap, and it can actually help with some resensitization.
I see. So it actually also improves the sensation.
Correct.
As well. Okay, that's quite incredible. So what do women tell you after they have reconstructed the breast? What usually is their feedback?
Well, the breast surgeons do tell me that, when my patients they go to see you and they come back to me, they're different, it's like they have a glimmer of hope. They are more positive. So, patients, it's hard to hear that from patients because patients, they've only been through that one experience, so they can't compare if they have lost their breast. Right? So I hear it from, the feedback from breast surgeons and also patients that did not undergo reconstruction. So they lived with the mastectomy. And then they realize that, I want to have the reconstruction done now. So what we call delayed reconstruction. Then they're able to feel the difference for that.
And I think one of the main things people worry about is always scarring, right? But people don't realize that actually they don't have to live with the scarring because like you say, a lot of your patients also have lasers after the surgery and that can actually help the scarring. So it's not a death sentence if you scar also.
Scars usually improve. Scars will always be there, but they can be improved to the extent where patient can live comfortably with it.
So what take-home messages do you want to give women who are considering breast augmentation, be it for reconstruction or just cosmetic reasons? Is there something you want them to know?
First, again, I want to emphasize that women should go for their breast screening after the age of 40. And I screen every patient before they come for their breast augmentation surgery, just as a baseline. And I would say that women should do it for themselves. I have patients that come in and say, I'm doing it because my husband has left me, or I think my husband will like this. And then
that's not a good reason.
So they have to do it for the love of themselves.
I think
and again, look for surgeons that are specialized in this form of surgery because you're still undergoing quite a moderate to moderate surgery after all. So always do your research.
And there's so many fine details that you have mentioned that I really think that this isn't just like putting an implant in. There's so many things, the sensation, the breast tissue, the size of the scar.
And the longer I do this surgery, right, the more fine things I start to take notes of and trying to address them and correct them.
Symmetry, which direction the nipples are pointing. I think this is very important.
So there's a lot of things to consider. And also I tell patients, if you are not very sure, always you can visit two specialists, two doctors and get a second opinion so that you can make a more informed decision.
And sorry, just one last question. So after a breast augmentation, is the screening the same? Does it make it harder?
You can go to any screening center and you just tell them that you have implants.
So they'll still do the mammogram as before, but a special view, right?
Yeah. So they will do what we call the Eklund's view. And there's one additional view. And nowadays we have 3D mammogram, which is multiple views. So you can choose to have the 3D mammogram done. And if there's anything that can't be visualized properly, if you have implants or if you don't have implants, sometimes things are not visualized properly, then patients can go on to have MRIs for the breast.
Very good. So thank you very much. We really enjoy having you on the show.
It's my pleasure to be here.
Thank you for joining us on Rebuilding Hope, the art and science of breast reconstruction. And a special thanks to Dr. Chia Hui Ling for sharing her invaluable insights on breast reconstruction and her inspiring work with BRAS and Smile Asia. If you found this episode informative and inspiring, please give us a thumbs up, subscribe to our channel, and hit the notification bell to stay updated on our latest episodes. Feel free to leave your questions and comments below. Until next time, stay beautiful and stay informed. This is Dr. Lo Chai Ling signing off. Bye-bye.